President Trump is expected to sign an executive order that would open the door to federal funding for research into the psychedelic ibogaine.
This natural substance has been used to treat brain trauma, depression, addiction, and other disorders. News 8's Richard Allen is here with more on the potential benefits as well as potential health risks of a drug that is, Richard, actually still illegal here in the United States.
Well, that's right, but this could be a game changer in using psychedelics like ibogaine in treating PTSD. Now, right now, ibogaine is classified as a Schedule I drug here in the United States, alongside other drugs like heroin and ecstasy. Now, because of that, many Americans, including veterans suffering from PTSD, travel to Mexico or other countries to visit clinics offering the drug. But this executive order could be the first step in eventually making ibogaine available here in the U.S.
This molecule's been around since the dawn of time.
Trevor Miller is co-founder of Ambio Life Sciences, which operates 6 residential clinics in Baja, offering the psychedelic drug ibogaine.
Puts people into a psychedelic trip for about, 10 to 20, 30 hours sometimes.
So far, Ambio has treated over 3,000 people over the past decade for everything from depression and anxiety to addiction, brain trauma, and post-traumatic stress disorder.
We treat a lot of U.S. Special Forces veterans.
Ibogaine comes from the root bark of the iboga plant, which is native to a number of African countries.
I think it's just really important for people to take a look. We know that more studies need to be done. That's what we've been crying for.
And those critically needed studies, including large-scale clinical trials here in the U.S., may now be imminent. CBS News has learned that the White House is currently drafting an executive order that could greenlight federal funding for this research.
What we need is the clinical trials, and hopefully that's what President Trump is about right now, is just making research more accessible.
While smaller studies have indicated that ibogaine can successfully reduce PTSD, depression, addiction, and other disorders, the potential for serious health risks, specifically to the heart, also exists. One report in 2023, reviewing 24 studies involving over 700 people, showed that at least 27 people have died after taking ibogaine.
It's very safe as long as it's done properly.
Miller says that at his clinics, where clients often stay for up to 5 days, a number of medical precautions are taken.
So there's a lot of screening that goes into it, an EKG, blood work. Everybody's hooked up to heart monitors while we're actually giving the medicine.
He's hopeful that more comprehensive research into ibogaine could prove to be a game changer in offering this treatment to a wider number of people.
We just basically need to turn this into a prescription drug. And once it is a prescription drug, FDA approved, then we'll be able to operate clinics here stateside, which is the goal.
And again, President Trump is expected to sign this new executive order as soon as this week. However, according to CBS News, the Trump administration does not plan to reclassify ibogaine for medical use, at least at this time, but perhaps down the road.
Okay, because there is now this federal movement into researching the medical benefits of this psychedelic drug. What about states? Have any states moved forward?
Well, it's really interesting, and it might be a little bit surprising, but Texas has actually made a big push toward researching ibogaine. Its governor last year signed a $50 million research grant, approving $50 million for research in the state of Texas to study the benefits of ibogaine. Also, Oklahoma, Mississippi, and Arizona have also been pushing for more research at the state levels.
Okay, California likes to be on the cutting edge.
Right,
So are we doing anything here?
Well, we're not putting $50 million into it, which Texas is doing. But a couple years ago, Governor Newsom signed AB 1103, which actually accelerates and eases the approval process for studying or researching psychedelic drugs, and that would include ibogaine.
Very interesting.
Very interesting. We'll see what happens, especially if this goes through at the federal level.
Looking for things that really work to treat those conditions. Got to leave no stone unturned.
Exactly.
Thanks, Richard.
Thank you.